Miss Live ആണ്.
Vidhi, please take over.
Push harder than yesterday if you want a different tomorrow. Good evening, everyone present here. I am Bittimol Verghese. First year BSc Psychology welcomes each one of you to the 18th session of Psy Hub International Webinar Series organized by the Postgraduate Department of Psychology and Internal Quality Assurance Cell of Christjoti College of Management and Technology. Today's topic of discussion is a matter of utmost importance. Our topic is youth and addiction. Now, without further ado, let's move on to the session. Prayer is the best weapon we possess. It is the key that opens the heart of God. I now call upon M.V. Nandana, first year psychology, to lead us in the prayer.
Make me a servant, humble and meek. Lord, let me lift up those who are weak. And may the prayer of my heart always be, make me a servant, make me a servant, make me a servant today. Even though I wear in the form of God, you took the form of a slave. You accepted death even on a cross, so God exalted your name. Make me a servant, humble and meek. Lord, let me lift up those who are weak. And may the prayer of my heart always be, make me a servant, make me a servant, make me a servant today. Make me a servant, make me a servant, make me a servant today.
Thank you, Nandana. Christjoti College of Management and Technology proudly hosts the Psy Hub series under the Department of Psychology. The Department of Psychology provides students and like-minded community with a new learning experience. Today, we are here to be the session led by Ms. Sajana Sajan, psychologist. May I welcome Ms. Anisha Rajan, Assistant Professor for Psychology, KCMT, to welcome the gathering.
Thank you, Vidhi. Good evening to one and all. Mark Twain once said, "The secret of getting ahead is getting started." The Postgraduate Department of Psychology, Christjoti College of Management and Technology, is honored to welcome you to the 18th session of Psy Hub webinar series, Youth and Addiction. First and foremost, joyful in welcoming our young, vibrant, and the most beautiful resource person of the day, Ms. Sajana Sajan, psychologist, MPhil Clinical Psychology trainee, Amity University, Lucknow, as a chief guest and resource person of the day, a person who needs no introduction, as she was once a part of our Christjoti family. On behalf of the entire Christjoti family, I welcome Ms. Sajana Sajan to the session. Next, I would also like to welcome our very respected principal, Reverend Father Joshi Cherankuri CMI, for being a constant support and a guide for organizing this webinar series. Welcome, Father. Sincere welcome to our beloved Vice Principal and Head of the Commerce Department of Christjoti family, Dr. Verghese Anthony, for his sincere consideration and appreciation in all our academic initiatives. Welcome, sir. Next, I would like to welcome our Head of the Department, Dr. Angel Thomas, a person behind all the webinar series and the efforts taken are sincerely appreciated. A hearty welcome, Miss. I'd also like to welcome the IQAC coordinators, Dr. Sushil George Joseph, and Joint Coordinator, Dr. Anuhani, for providing us such a platform for us. I would also like to welcome the Joint Coordinator of this webinar, Ms. Binita Rose Benny, Assistant Professor of Psychology, for her untiring support. Hearty welcome to the department heads, fellow teachers, and all the students and participants who have joined us through the Zoom and YouTube platforms. Once again, welcoming you one and all to this webinar series, Youth and Addiction, a Need of the Hour. Thank you and welcoming all.
Thank you, ma'am. Now, I request Parvati V, first year BSc Psychology, to introduce our resource person.
Good evening, all. I am Parvati V from first year BSc Psychology.
I'm extremely happy to introduce our guest speaker of the day, Ms. Sajna Sajan. She is a person who has a strong passion and genuine interest in the field of psychology, and this has motivated her to take psychology as a major during her higher secondary years, and she has done graduation in psychology from Kuriakose Elias College, Mananam, and post-graduation from Christu Jayanti College of Bengaluru. She has completed many certificate counseling courses from various authorized counseling institutions. She was also associated with District Mental Health Program as a volunteer psychologist, where she was primarily giving counseling support to COVID-affected people. She has also worked in the postgraduate department of psychology, Christi Jyoti College of Management and Technology as an assistant professor. Currently, she is doing her MPhil in clinical psychology at Amity Institute of Behavioral and Allied Science, Amity University, Lucknow. Immense happiness and gratitude, I welcome the most versatile personality who adorns this function with her presence and voice. Thank you, ma'am. Welcome you very heartily. We are eagerly waiting forward to hear from you. Thank you.
Thank you,
Thank you,
Parvati.
Just a little instruction before we get started. Please mute yourself to keep the quality of the sound functional, and you can unmute it only if you're advised to do so. If you have any queries during the presentation, please type them in the chat box, which will be clarified towards the end of the session. The feedback forms will be provided towards the end of the session in the chat window, and once you submit the feedback form, these certificates will be provided. Now, let's move on to the much awaited session. Let me proudly call upon the renowned speaker, Ms. Sajna Sajan, for the session. Over to you, ma'am.
First of all, thank you, Anisha, Miss, and Parvati for that amazing introduction. I am extremely honored to be a speaker for today's session. Since this is an institute that is very close to my heart, I'm extremely honored and happy to be a resource person for this function. Without much explanation, let's move on to the session.
So sorry, there is a small network issue.
Hello.
Miss, can you please share the slides?
Sure. I hope.
All set, Miss.
Yes.
Yeah.
Yes.
I hope I'm audible.
Yes.
Screen is shared. Okay. So the topic for today's session is youth and addiction, which is a very important topic. And before moving on to this topic, I would like to show a few pictures. These are few things that happens in our day-to-day life: getting a surprise from a loved one, helping someone, going out with your friends, or having good relationships. So I would like to know, what are the primary emotions that came to your mind after seeing these pictures? Can I get a response?
Yes, ma'am, you're audible.
Okay. So can someone tell me what was the primary emotion that came to your mind after seeing these pictures?
Mother.
Mother. Can you specify the emotion that came to your mind?
Happiness.
Happiness. Oh, thanks for that answer. That was the one answer that I was expecting. So happiness. It's an emotion that is praised by a lot of people, and that is one emotion that all of us seek throughout our life. And this particular emotion is very much important for the survival of human beings as a species. Because when you look the evolutionary perspective, we can see that the happiness or seeking pleasure and avoiding pain was one particular character that has helped our ancestors to survive. And we human beings are desperately trying to find this particular emotion throughout our life. To get happiness, we involve in a lot of functions. We interact with a lot of people, we create connection, we do things that gives us happiness. And these are few methods that we try to create this feeling in ourselves. So the speciality about happiness is that when a particular person is happy, it's like giving a present to your brain. Your brain is getting a reward for being happy, and your brain tries to remember that experience of being happy. And this experience of getting a reward is very much important for your brain's survival, because human beings' brain are hardwired to respond to rewards. Rewards are a very good motivator to motivate our behaviors, and it aids our survival. For example, after seeing this piece of cake, we get that craving to eat that piece of cake. For example, just imagine if the food was not rewarding, will we eat food? No. If friendship didn't give us happiness, will we go for friendship? No. Everything that we do is somehow related to the rewards that we get. And that is one function, that is one way our brain works. Our brains are desperately looking for rewards. And here, as in this picture, when I am seeing this piece of cake, a lot of changes are happening in my brain. For example, a chemical called dopamine is released in my brain, which signals my brain and says that, hey, listen, a reward is given to you, so be happy. So this dopamine helps to increase the idea that we are getting a particular reward. And our brain produces dopamine not only when we are getting a particular stimulus that is rewarding. Instead of something is giving us an idea of a reward, that also increases the dopamine release. For example, I'll be happy if I get a piece of cake. Also, if I'm very hungry and I'm traveling for a long time, I was not able to find any hotel or anything. I was very hungry, I was starving. And then I found a board which says that hotel. So that sight of that board will gives me a hope that I am going to get food from that place. So at times, it may not be the original object that is giving you the happiness. It can be object that reminds you of something else, can also gives you happiness, or that can produce dopamine. I hope the concepts are clear. So coming back to the example of this particular cake. When I see this particular cake, I feel a craving to have it. But since right now I'm taking this session, I can't have this cake. So I can resist my urges. I can control that. Maybe I can have a piece of cake after the session. But at times, we human beings will fail to resist these urges that are coming within us. For example, if I'm very hungry and I'm seeing something, there are more chances that I won't resist my urge. I'll go for that. our brain is also working in this particular manner. For example, if you're getting something or engaging in a pleasurable activity, dopamine is released in your brain, and other brain parts such as hippocampus and amygdala records this level of dopamine and says that, see, this particular instance is giving joy to you. Remind about this. So in the future, you can look forward for this. So when we are doing something that is rewarding, our brain stores that information and it again helps us to go and get that rewarding situation in the future. It is not limited to rewarding situation. It can be situations that help our survival. So this dopamine and the circuit has that particular mechanism to aid our survival and help us to cope with our future. So in a case, if I'm full, I had a full meal, I'm completely full, I don't feel like eating something. And if you offer me a plate of rice and some curry, I might say that, sorry, I'm not hungry, I don't want it right now. But if you're giving me something that is very much tasty, that one thing that I really like, I might take a bite from that. At times, even if we are hungry, even if we are not hungry, we'll go for certain things that are really pleasant. For example, science say that foods that are high in sugar, fat, and salt are more appealing to human beings. And people tend to go for that. And certain researchers says that sugar is more addictive than cocaine. So this happens. There are certain food items that can hijack our normal functioning and make us go for it again and again. And one such item is the drugs or other actions or other substances that we take. And one important fact is that our brain works in the same way as getting a reward when we are taking drugs also. It's the same thing that is happening. As you can see in this presentation, when you are getting a reward, your dopamine is released and it stimulates the hippocampus, and then a memory is stored in your brain. It's the same pathway that is happening with addiction also. So now let's come back to our topic. What is addiction? Addiction is basically defined as not being able to control what we are doing or what we are taking or what we are using. And we may know the harmful effect of it. We may know the consequence of it, but we are not able to control that craving for that. We'll still keep on doing that. We have seen alcoholics who takes alcohol, even though they know that their liver is having some issues, they have certain health issues, but still they keep taking that. Even if addict knows that he or she is having a lot of family problem due to his drinking pattern, they at times continue to take that substance. And this particular condition is called addiction. And addiction or substance use disorder is characterized by craving for that particular substance or that particular activity, and a tendency to compulsively do that thing, and a condition called tolerance. Tolerance is basically, initially if you were taking this much alcohol and it used to give you kick, but after the continuous use, the drug works less and less over time and you need more quantity to satisfy you. That condition is called tolerance. And another characteristic related with addiction is the dependence that we develop. That means we feel very much agitated when this particular substance is going away from us. We feel dependent to use that again and again. These are few features of addiction. Okay. and it's characterized by craving, compulsive use, tolerance, dependence, and all. So there is one question that comes to my mind. Is it just the alcohol or drugs that we are getting addicted to? So researchers says that, and the current science believes that it is not just substances that we are getting addicted to. People can get addicted to physical substances like alcohol or drugs, as well as people can develop behavioral addictions. For example, addiction to have sex, addiction towards work, addiction to have a lot of food, addiction towards pornography. All these are examples of behavioral addictions, or situations in which we keep on engaging in a behavior even if we know that it has a specific consequence. And till now we have seen that how the reward system of our brain works, and why is it very much close to addiction, and how addiction is influencing our reward system, and what addiction is, the type of addictions. Now the question is addiction a choice? What do you think? Is addiction a choice that people make?
Yes.
Yes. So let's come back to this after some time. So for a long time, people used to believe that even though they know the negative consequence of all these things, they are not stopping that. And maybe because they are thinking in that way, it is their problem, it's their choice. That is the belief that a 90% of us are holding. But let's discuss few other things and think whether it's a choice or not. Okay. So whatever addiction it is, it has a lot of consequence on your physical health, your social life, your other behavioral aspects. It has a lot of effects. But I would primarily like to focus on the fact how it is affecting your brain. Is it making some changes to your brain? So research findings and various studies in this particular field shows that addiction, whether it be behavioral, whether it be physical addiction, it has an impact on your brain at different levels. And almost all type of addictions have neurochemical or neuroanatomical aspects towards it. If you're taking alcohol, it's causing some neurological changes. If you're taking some marijuana or any other kind of drugs, it's causing a kind of change in your brain. And different kind of addictive substances have similar effect. That means it is affecting the brain in the similar way, but different areas of the brain. Alcohol might be affecting a particular area of the brain, and drugs might be affecting another area of your brain, but the action or the effect that is causing to the brain is similar in almost all the addictions. When we are addicted to some behaviors, or when we're addicted to certain things or substances, there are mainly three portions of your brain that is getting affected by it. The first one is, sorry, there is a small mistakes in the numbering. The first area that is getting affected is the prefrontal cortex of your brain. That is this particular area. So this area of human beings are very specific, or this area of the brain is responsible for decision making. So this area tells it whether it is good or whether it's bad, and when to use our logic, and it helps us to reason about things, make judgments. Everything is controlled by this prefrontal cortex. When we are taking or when we are addicted to something, this is one area that is primarily getting affected. And the second area is the limbic system. As you can see here, this is the limbic system. So limbic system is basically responsible for your emotions, and it also associated with the reward circuits of the brain. That means this particular area tells us whether a particular experience was a pleasant, whether I should remember about that pleasant experience so that I can use it later on. All those things are controlled by this particular area. And the third area that is being affected due to addiction is the midbrain. Midbrain is basically associated with our survival functions. That means our vision, hearing, sleep-wake cycle, alertness, temperature regulation, and a lot of important functions. And all those things are controlled by our midbrain. So these are the three areas that is getting affected when you are addicted to something. So when a drug is first administered, there is a rush of the neurotransmitter dopamine. So this dopamine is responsible for our cognitive functions, movement. It is associated with a lot of factors. So when we are taking drugs, there is the, when we are engaging in any sort of pleasurable activity, not just addiction, any sort of pleasurable activity. For example, when I'm getting a surprise, a constant amount of dopamine will be produced in my brain. And if I'm meeting an old friend after a long time, some dopamine will be released in my mind. That gives a pleasant feeling. But if a person is taking a particular drug, the amount of dopamine produced in the brain is drastically different from a normal experience. That means drugs have the ability to produce inhuman amount of dopamine that you can get from any other natural experiences. That is the specialty of drugs. So when we take drugs, a large quantity of dopamine is produced in your brain, and the presence of this dopamine stimulate another neurotransmitter called glutamate. And this glutamate is responsible for the memory. For example, if this particular neurotransmitter is present in your brain, that help you to remember something or memorize something or to save it in your brain. When you're taking drugs, dopamine is produced in a large quantity, and also glutamate is produced. And this increased dopamine and glutamate in the brain makes this midbrain more sensitive to the need of drugs. That means it constantly feels like having more and more of this particular substance, because a large quantity of drugs can alter the functioning of that midbrain. So if this condition is happening, if our midbrain is getting more and more sensitive to the need of drug, we have already discussed that midbrain is something that is really responsible for your survival. It controls all the activities related to your survival. So if the particular area that is responsible for your survival is getting affected due to these drugs, it affects your complete well-being. If that's a scenario, you'll forget about all other needs. You will forget that you're hungry, you'll forget that you need water, or your safety, your sense of belongingness, your connection, everything else will be replaced by this need of this particular substance. It overpowers all the other needs of your life. So imagine if I'm locked in a room for 2-3 days, my primary need is food. So that is how my body is working. If that doesn't work, I might starve and I might die. But taking drugs or getting addicted to certain substances are actually altering this complete balance of your brain and making your brain believe that this particular addictive substance is one thing that you want, out of everything. So your body and your brain craves for that. And the regular use of a particular addictive substance, use of the substances initially gives a lot of pleasure, but a recurrent use of this, regular use of this addictive substances can cause the exact opposite function. We may take alcohol to get high, but what it might be doing to you after a long time is that it might make you feel low. It has an opposite effect, and it has a neurological reason for that. So people can think that, why can't someone stop using that? If it's not helping them, if it's not giving them that good feeling, why can't someone stop using the substance? Or why can't our prefrontal cortex, which is responsible to take judgment and to tell us what is important, what is good for you, what is bad for you, why is this particular area not functioning? Why can't this particular area tell us not to take that particular drug? That is one question that can come to all of your mind. And the answer to that is, when you see the human anatomy, this is the brain, and this is the midbrain that we were talking about. And this midbrain is one thing that is directly connected to your spinal cord. So since it's close to the spinal cord, all electrical signals that you get will be going to the midbrain first before it reaches the prefrontal cortex. Since your midbrain is already altered, it is already influenced by the effect of the drug, it can't think about or decide whether to drink or not to drink. The midbrain affects your thinking and other things, and it hijacks you. So an addicted person, when they are getting a thought of drinking, or when they're getting the thought of using drugs, there are multiple options. But since their brain structure is already altered, they may not be always able to think about that. Their prefrontal cortex can't make decisions at times. Subconsciously, their body and other parts of their brain are craving and demanding for them to take that particular substance. So for an addict, it is just this pathway, thinking about something and taking that. But for a normal person, they will be able to use their prefrontal cortex and think, what if I take this right now? What are going to be the negative effects of this? What if I not use this? What if I use this? They have multiple options. But for an addict, their brain functions in a completely different way. Before having a choice of addiction, most of the brain is already prepared to get that particular drug, and the brain is craving for that. So this is the reason why most of the addicted people are unable to change their habit, even though they know that this is not going to help them. They have that thought, but they're not able to control that. Just imagine wanting to do something, but you're unable to do that. That is exactly what is happening with most of the addicts. I'm not saying that all the addicts want to quit their habit, but there are a lot of addicts who are trying to quit their habits, but they're unable to do because of their physiological adaptations after continuous use of this drug. So we were discussing about the effect of drug on our brain and other things. But in reality, our topic was youth and addiction. So the youth part was missing. Let's come to that. So 90% of addiction has its root in adolescence. Right now, I'm working in a de-addiction center, not a de-addiction center, but a hospital that has a lot of substance abuse cases. So when you take the case history, it's very shocking. It was very shocking for me to realize that a lot of people started using these substances when they were around 12 or 13 years, or maximum 15 or 16 years. That's the prevalence. or that is when they started consuming those things. And for 5-10 years, it was all okay. But after that, they became addict, and it started to influence a lot of their functioning. That's the reason why they are in a hospital right now. And researchers also says that when you take 10 addicted people and you ask when did they start their drinking habit or using of drug, most of them might have started it in their adolescence or years. So now let's discuss about what is special about the adolescent brain that is that we need to focus on. So we might know the fact that our brain rapidly develops in the first 5 years of our development. When you have if you have seen the Horlicks advertisement or any other substances, they say that for brain development for kids, by 3 years, this much part of your brain is developed. By this much years, this much part of your brain develops. That's a fact. And most of our brain development happens in the younger age. A massive growth happens. And by the time when you're 6, your brain is already 90 to 95% of the adult size. And the childhood time is the most critical time for your brain to develop. But even though it has acquired the size of the adult brain, it still needs a lot of remodeling, rearrangements, and other things that needs to be done in the following years. So this changes happens during this remodeling and changing, everything happens during the adolescence years, or maybe in the teenage years. Or maybe even we can say that till the mid-20s, our brain will be developing. And our brain changes depends upon the age, the experiences that we are getting, the kind of environment we are in, and the hormonal changes in puberty. All these things aids in the development of our brain. So when you talk about the brain of a teenager, the speciality is that basically there are a lot of connections in the brain, neural connections in the brain. So for a teenager, when they are in their teenage years, a lot of changes will be happening in the brain. Unwanted connections will be cut down, just like you cut down and remove the excess part of the garden. Unwanted connections in the brain is cut down and it is removed. And the wanted or necessary things are being strengthened. That is being remembered. And this process is called neural pruning and all. Very scientific, leave that. So a lot of changes is happening in the brain. So this particular process of making things clear or making things developed or complete happens from the back of the brain. So things first happens here, changes first happens here. Remodeling first starts from here, and then it slowly comes to this part. So as we have already discussed, this particular prefrontal cortex is responsible for judgment and other things. That will be the last area which will be modeled or which will be changed in a teenager's brain. So most of the teenagers, they mostly depends upon rather than using this particular area for decision making, they might use other areas in order to think or decide. And that has an effect on the decisions that they take. That is the reason why teenagers are risk-taking. That is the reason why they engage in all risky and impulsive behaviors, because the area of their brain that is responsible to think logically and reason and to decide whether this is good or bad is not fully developed. They are working with brain that is not completely developed. So it can influence their behavior in a lot of ways. So as you can see this chart, the development of the prefrontal cortex is going in a very slow pace. But the development of the limbic system that we have already discussed, the limbic system that is responsible for emotion, rewards, and other things, that is developing in a faster way. That is being shown in this. As you can see, those areas develops faster before the prefrontal cortex develop. So during this portion, the teenagers rely on the amygdala or the limbic system to make decisions. Since they are using that particular area of their brain, they will be very impulsive, and they'll go for instinct gratification. They function based upon the emotional needs and other things. They may not think about the logic. And this is what is happening with them. So just imagine if a teenager is getting exposed to something that is very dangerous, when they are not able to think or process about it in a particular way, when their brain is not ready to process that particular fact, when they're getting exposed to that, there are a lot of consequences that can follow. So studies say that our brains are more open when it is young. That means young people can learn things faster compared to older people. So the brain is always in that active state to learn things when we are young. So this is applicable to teenagers also. Their brain is ready to acquire things, learn things, and change and function accordingly. And getting addicted to something is similar to learning something. Addiction is a learned behavior. So since the teenager's brain is functioning in a particular way, they are primed, or their brain is working in a way that is very much vulnerable to get addicted. So finding says that teen brain can get addicted to substance faster, or it is more vulnerable compared to adult brain. Adult brain takes more time to get addicted to something, but teenage brain can get addicted to something easily. And also a lot of researchers says that when coming to the point of quitting something or stopping something, teenagers have a lot of difficulty to stop a particular addiction, but adults will be more able to do that. And the impairments that are caused due to the addiction is more in the teenage brain. That is, there will be long-lasting effects that is happening to the teenage brain. I happen to read about a research which says that, which shows the findings that teenagers who are chain smokers, who smokes a lot, their brain develop differently from other teenagers. The brain is functioning or developing in a completely different way. So this is the reason why this particular topic is important. And also it is found that if a person is starting to use an addictive substance before age 18, there are 25% chance to become an addict. But if they are starting the use of a particular substance after age 21, there is only 4% chance for that person to develop a particular addiction. And this is one reason why there is a legal age to purchase cigarettes and alcohol and other addictive substances, because there is biological factors that are different in kids. And it is an important topic, not because this is something that is related to kids, but the survey and a lot of researchers that have done in the field of addiction has says that a lot of people, including children, are addicted to a lot of substances. So I have added the picture of few findings from the survey conducted by Ministry of Social Justice and Empowerment Department in 2019. It talks about the use of alcohol, the prevalence of alcohol, and as you can see in this picture, the total population from age 10 to 17, 14.6% people use alcohol. And in that 14.6%, 1.3% are children who are between the age of 10 to 17. And also, when we are talking about Kerala, a recent news report says that Trivandrum, Ernakulam, and Calicut in Kerala are listed in the 127 vulnerable cities identified by the Union Ministry of Social Justice with acute prevalence on drug dependence, which means that among 127 most vulnerable cities, the cities like Trivandrum, Ernakulam, and Calicut are part of that. That means the substance abuse is not something that is happening in some other part of India. It is also happening around us. We can see a lot of people, a lot of kids getting addicted to a lot of things. And also news reports, when you go through the news report, it says that alcohol dependence is increasing among school children in Kerala. And in 2008, drug-related cases in schools were 508, wherein when it was 2017, it increased to 9,200 something. In just 8-9 years, there is a drastic shift from 5,000 to 500 to 9,000. That is the reason why we are discussing this. This particular condition or this addiction among youth is increasing day by day, and it has a lot of other consequences also. These are few findings of different drugs. And also one thing is that among the use of inhalants are things that we sniff or take to get a high state. So the use of inhalants by students is greater because students don't have access to, school-going students may not always have access to other drugs, but they can always abuse the whitener, gum, and other things that are easily available. So these are few statistics. I'm not going in depth of that. I just wanted to show you the importance of those things. So I think we still have few minutes. Anisha, ma'am?
Yes, miss, we do have.
Yes, miss, go on.
Okay. So, since till now we have discussed a lot of facts and other things about addiction and addiction in youth, now let's talk about some myth prevailing around the addiction. So, coming to the first thing, it's a choice. That was one thing that we have discussed in the beginning of this session. But recent findings says that initially we all tend to believe that addiction is a choice, but it's not a choice. It's actually a brain disorder. It's not because of out of their choice. People who are addicted, they are in a chronic relapsing disorder in which they can't come out of it. This is not something that I am saying. This is what the science says. And now we have the tendency to use addiction in almost everything. I'm addicted to this particular series. I'm addicted to ice creams. We are in a way using this addiction every place, in every place. But in medical field or in the field of behavioral science, addiction is something that is a very serious condition, which has a lot of characteristics associated with that, which is a chronic relapsing disorder that really affects your brain, that really creates a change in your brain. And the people who are addicts, they have a compulsive behavior to get that particular substance, even though they know that it's not going to help. So that's the first myth that we need to unlearn and replace with the fact that addiction is not a choice, addiction is a brain disorder. The second myth is, I can drink and still be in control of my drinking. But the fact is, we have already seen that when we are drinking, our brain is getting affected, especially our prefrontal cortex, which is important for the judgment. And this increases the likelihood that you will do something that is not appropriate. And this is one reason a lot of criminal cases or issues are associated with drinking. After drinking, there are chances for a lot of issues to happen. Okay, 1 second. Hello, am I audible?
Yes, ma'am, you're audible.
Yes, ma'am.
Is my video on?
No, miss.
No, ma'am.
Oh,
Yes.
okay.
Yes.
Okay, thank you. So some people think that I can take alcohol and I can control everything. I have good tolerance. I don't get high easily and all. But the fact is, it's not based upon how much drink you take that makes you addicted to something. I'm talking particularly about alcohol. It's basically based on the amount of alcohol that is present in your blood that is causing the kick effect or creating intoxication in you. So as the level of the count of alcohol content in your blood increases, you can be sober, or if it is around 0.03 to 0.112, you can be in a euphoric and excited phase. And if the count again increases, you can get confused. If it's increases to a very great extent, it can lead to coma or even death. Acute intoxication or acute binge drinking can sometimes lead to death of person. And also science says that the amount of alcohol that gives kicks to a person is different for males and females. There is a gender difference also. It's based on the physiological mechanism of people. So females take more time to metabolize alcohol. That is why they get high easily. So that is one myth that we need to discard. You can drink and you can be in control of that. So another thing, myth that most of the people hold is that I'm only drinking beer, I'm not taking any alcohol or any other drugs. But the fact is, if you're taking half bottle of beer is equal to the effect of taking 30 ml of pure alcohol, or drinking a full glass of wine is having the same effect. In the case of alcohol, we count the basically the alcohol present in that. It's not how much you drink, but how much quantity or how much equivalent of alcohol in you is present. So that is causing intoxication. So if you want to understand how much unit you have consumed, there is a particular formula to calculate it and understand it and all. So I'm not going in depth to that topic because we are running short of time. We can come back to this if you have doubts. So another myth is that Once you're addicted, there is no hope for you. But that is not the fact. There is always treatment available, and it can help, and it can help you to reverse the effect of effects that are caused by addiction. So this part of the alcohol, I'm not going into this. There are a few other facts associated with youth and addiction, and a lot of adolescents die each year as a result of drug or alcohol related accidents, as I have already mentioned it. And the three leading causes of death for 15 to 24-year-old are automobile crashes, homicides and suicide, and alcohol or drug use. These alcohol and drug use is one among the three leading causes of death of people between the age of 15 to 24. And adolescents who take alcohol and tobacco, there are more chances for them to take other illicit drugs also. And at times, the excessive consumption of alcohol can lead to a lot of psychiatric conditions associated with that. It can sometimes trigger depression, anxiety, and also due to the excessive use of alcohol, some people develop psychosis, manic features, and a lot of other psychiatric conditions. And yeah, those are few facts related to alcohol addiction. And now let's talk about why people choose drug, especially why do young people choose drugs. So there are a lot of reasons why they go for drugs. One reason is to fit into the culture, or fit into what is being told to them as normal, because everything that they see, that they hear, gives them the idea that this is normal. And people who takes alcohol and other things at a very young age, they do believe that they are doing something that is required from a person of their age. That is what they believe. If a 12th class student is not taking alcohol, he or she, especially if it's boys, there are chances for that boy to get teased by his friends. You're not doing that. So there is a lot of information in the mind of children saying that this is something normal and this is something that is expected from you. So young people can sometimes do these things to fit into this. And some people do this to escape or relax. And some people take drugs to relieve from boredom, especially when it is it's not just drugs, it's some behavioral addictions. People do things to relieve their boredom. And they wanted to take or use drugs in order to seem grown up and to be rebel, in order to satisfy their instant need they take. If research findings also say that people who are lacking in confidence, who are very low in confidence, there are chances for them to consume alcohol in order to give them a feeling of superiority and gain that confidence for some time. And due to a lot of misinformation, young people take this, and due to peer pressure and due to experimentation, there are a lot more factors to add to this list. Why do people choose drugs? These are some reasons that we find, but there was a research conducted, and in that particular research, they asked people, why do they take drugs? And the addicted people say that they take drugs for enjoying the effect of that particular drug, or for recreational purpose, or to get relaxed, or to socialize with people. So these are few reasons why people might take drugs. And those are few reasons that can be attributed why people are taking that. But have you ever thought that some people can drink alcohol or take substances socially, whereas some people get addicted to that? There is a phase between the transition of using that and requiring that. Requiring that is a state when we are addicted to that. All people may not go to this extent. Some people will go to that extent, and it happens due to a lot of other factors. There are various reasons to say that why people are getting addicted. So this addiction has different causal factors. There is genetic factors, there is environmental factors, there is developmental factors. For example, we can say that on an individual level, the genetics or the heredity of that person can influence. Also, the characteristic traits in their behavior can sometimes trigger to use a addictive substance more. And also the quantity in which they take, or the time of onset, all those things can influence the addiction. Also the environmental factors like the culture, peers, the stress and trauma that person is facing, all these factors are other causal factors of developing an addiction. Also, research finding says that when you talk to a lot of addicted people, the researchers were able to find that most of the people who were addicted, they had a lot of traumas or abuses in their past lives. So these developmental factors can also sometimes cause addiction, or can trigger the development of addiction in people. These are various factors. These are not the only factors that triggers addiction. There are a lot of other factors also. But I would personally say that the root cause of addiction is something that is very different. When you talk to people, other than the textbook information that we get, when you meet people in real life, and when you are talking to addicts, when you are dealing their cases, most of the time the root cause of addiction will be different. And in a lot of cases, among a lot of causal factors, I would like to stress on the point that most of the addicted people are depending or getting dependent to something when they are in a very bad situation of your life. Most of the people, I'm not saying that everyone, but most of them, majority of them start this addiction or start the use of substances when they are stuck, when they are unable to find a solution for a particular thing. And maybe we can say that it's not characterless people, but addicted people are people with poor skills, not being able to control their impulses, or not being to cope with the stressful situation in a healthier way. Instead, they are prone to depend to this particular pattern. So they are people with poor coping skills or poor decision making skill. That is one way of putting addiction or viewing addiction. So when it comes to treatment also, cause of addiction is important. We need to understand where is this addiction coming from, what causes that person to get addicted to a particular substance. And here I have included a lot of other factors to understand if a person is drug addicted. Especially parents can, we can make parents aware of these trigger warnings, to look into their children, to understand whether they are using something. Young people are very intelligent, and they can hide and keep their addiction without letting others know about it. So parents, teachers, and other people, other elders should be more vigilant towards their behavior. They should be able to understand and observe them. I'm not saying that they should be constantly watching them, not allowing them to do anything. It's not like that. But create a safe space for them and try to observe them deeply. And these are few things we need to check with whom they are hanging out. Is there any personality change that is seen in them? And are they using a lot of money compared to previously? And are they going out randomly? Are they having trouble with their friendship, or are they having a lot of new friendship? Are they sleeping a lot and not being able to concentrate on this, whether they are losing their weight or gaining weight, or there is a lot of cutting classes and bunking classes and slip in their grades or their marks. These are few things that parents and other elders can keep in their mind and know whether the people whom they are associated with are getting addicted to something like this, or maybe tension, anxiety. All these are factors that help us to figure out these things. Okay, so now let's talk about the treatment. What can be done with an addict? So when talking about the treatment of addiction, it should be highly personalized treatment. It will be based on how I will be conceptualizing a particular case. For example, in psychology, we look at a problem from different perspectives. In a psychodynamic perspectives, they say that it's the hidden lack of, it's a defense mechanism. Alcoholism or drinking or addiction is a defense mechanism. Where in a behavioral perspective, we say that it's a learned behavior, it's being rewarded, that's why they're doing that. So different perspectives of psychology holds different view of looking at that problem. So how a psychologist or a clinician conceptualize that case can influence the way of treatment and how it goes. So that is an important factor that we all need to understand. And the treatment for addiction is highly personalized treatment. It is not the same treatment for everyone. But generally, we can say that we can, if they are in an acute state, we can go for detoxification process initially. Detoxification should be done under medical supervision in a safe space. It's not like if we stop giving the substance to a person who is an addict, that can negatively affect them. So these kind of detoxification or abstinence should be given under proper medical guidance. And there are a lot of medications that help us to balance or help us to control the withdrawal symptoms or control the craving for a substance. So medications can be used. Also, medications can be given for the associated conditions. There can be depression or anxiety or other mental health issues associated with addiction. Medications can be given for that. If there is psychosis associated with this and the person is not in a position to think about or process the facts, we give them medication. We depend upon medication for the first few period. Then we move to therapies. So when talking about therapies, I would personally suggest that if you want to treat a person with addiction, don't look at what is wrong with it or what is wrong with that person. Look at what is right with it, or I would say that what is making them to go for that particular behavior. Because addiction is powerful. Addiction gives them a sense of peace, sense of relief. I have heard people saying that if they take alcohol, then only they can sleep. It's somehow giving them something. So focus on that something that they are getting from addiction, rather than focusing on the things that they are losing due to their addiction. try to focus on the things that they're getting from it. If we are able to understand that these are the reasons why this person is depending upon this addictive substance, we can work or progress in that particular manner. So there will be a lot of other emotional reasons for a person to be an addict, other emotional factors. It can be the personality character of that, traits of that person. It can be the interpersonal relationship conflict. It can be the ego issues. It can be conflict. It can be due to a lot of other stressors that the person might depend on an addictive substance. So look for that particular factor and then proceed with the treatment. So coming to the therapy part, usually we use a lot of therapies like biofeedback mechanism, cognitive. In biofeedback mechanism, we basically try to monitor the body's involuntary processes, and the therapist help the patient to see and make him understand what is going on in their body, and in that way they're helping that person to come out of that. They might give a lot of physiological techniques that can help to overcome addiction and a lot of other factors related to that. And there is cognitive behavior therapy, and which focuses on the problematic thought that an addicted person is having. And in CBT, they also focus upon treating the co-occurring conditions. If there is any other disorders, they'll treat that. So cognitive behavior therapy is also very effective with addicted people. And there is this DBT, which is a new form of therapy, which has gained popularity in the recent years, dialectic behavior therapy. And it is very effective. And it basically try to improve your self-esteem, or maybe help you to manage your stress and other things, and thereby helping that individual to recover or remove that triggering factor from their life so that they can come out of that addiction. And there is this experiential therapy, which is also a very not a very recent one, but is something that we use with addicted people. It basically uses a non-traditional treatment method, and it focuses upon the repressed feeling and emotions that they have in them, and focus to comment upon that and then treat that. And a lot of holistic therapy systems are there. And then most importantly, with an addict, the primary thing that should be done is to assess their motivation level, in what state they are in. Are they in a position where they are aware that they have this particular issues due to their addiction? Are they ready to seek a treatment? So there can be different levels of motivation in people. So we need to assess their motivation level. If they are in a position, some people will be in the stage of denial. When I go to the inpatient department of the hospital where I'm working right now, majority of them have insight, but a lot of people are there who says that they don't have any issues. They say that it's their family members who admitted them here. So there are people in a denial state where they don't agree that they have any issues. But there can be other set of people who say that they have this addiction problem, but this addiction is because of other people. Since my wife is fighting with me, I am using alcohol. Since I don't have proper this thing, I am using this. And there can be people like that who accept that they have a problem, but the problem is not because of them. And there can be people who accept that there is an issue with them, but they may not be ready for treatment. And there is another set of people who accept that they have a problem and they are ready to change. Only if they are in this particular stage of motivation, we will give them treatment, or else we'll give them other motivation enhancement therapy to increase their motivational level in order to make them go for that treatment. And also there is psychodynamic therapy. Group therapies are very effective with people, especially being a part of self-help group and other things can really effectively influence them to overcome addiction. So in a practical basis, if we say that there are a lot of treatment methods, there are a lot of therapies, but it will be mainly based upon how the therapist is conceptualizing the case, or what is the real problem that is happening with that patient. If there is, that person is depending upon alcohol based on the family issues, we not only try to treat the addiction, we also try to solve the family issue or the reduce that conflict. In addiction, the important thing is that we can't just go and treat addiction this way. We have to solve other associated factors that cause that person to use this addictive substance. So it will be motivation enhancement therapy will be going on, and this MET, along with this MET, there will be other forms of therapy. There will be assertiveness training given for them. There will be other life skills being taught to them. There will be family counseling sessions given to them. A lot of other therapies. If they have some repressed feeling, we'll try to solve that. If they have some associated condition, we'll try to solve that. So it's like a combination of a lot of things, and based upon the need and reason for that person to be an addict. That is how we tailor the therapies for an addict. And also, there are a few things that I would personally like to share with you, being mostly the people who are listening to me right now are from the field of psychology. So when we are giving the treatment for addicts, try to involve the significant others also. And by involving the, if I am an addict, the treatment shouldn't be for me only. The therapist should try to involve other people who are very important to me into this treatment, so that I will be able to understand that how my addictive behavior have an inevitable consequence in my life. In certain therapies and treatments, we say the partner not to talk to that person if they have consumed alcohol, so that they'll be able to understand that if I am taking this, my wife is not talking to me, or these things are happening to me. This is just an example. This is not all one thing that we always do, but it is always better to involve the significant others in the addiction treatment. And also, the home environment after coming back from treatment is very important. We should give proper psychoeducation, make the family aware that how they should respond to them, how they should act with them, and what are the trigger warnings, how they can overcome that. All those kind of training should be given. So at times with addiction, people coming after de-addiction and all, we say the family members not to keep anything that reminds them of the alcohol. In most of the parts of Kerala, we have that habit of using alcohol bottle as flower vase and all. So a person who have just came out of the de-addiction center, when they're coming home and seeing this flower kept in this alcohol bottle, it gives the warning, just like what we have discussed. It not always the real thing, but things that remind them of something that is rewarding can also create the craving for that. So try to avoid such things from the environment, and also try to use hopeful words, a language of very positive language with them. And never be very judgmental with them. Like when they're planning to go out after the treatment and all, don't stand and ask them, are you going to drink? Maybe they may not be going for drinking or something, but when we are asking this, that can give them and trigger them the thought of getting a drink. So a lot of involvement should come from the part of family also. And another important factor is that most of the time, it is not the addict who suffers. It is the family who suffer with the addict. There will be a lot of issues that the family members will be facing. Humiliation, anger, adjustment issues, a lot of issues will be there. Some of the family members will be depressed due to this particular person's condition. So there was a case that came to the hospital recently where they're married for 10, 12 years. But when we were talking to the patient, we found that more than the patient, the wife of the patient is having a lot of issues. She have symptoms of depression, symptoms of adjustment disorder. She is struggling. She is not at all okay. But the husband, who is an addict, is in a state of denial that he don't have any issue. So in the treatment of addiction, always try to focus and treat the need of the family members. If they want some treatment or some support, give them that. And as therapist, it will be better if we can practice this by ourselves and then treat people with addiction. So there was this concept that I have read recently, which says that if you are a therapist who is treating addicted people, try to stop yourself from doing something that really interests you, or try not to use something that is very important for you. Maybe we can abstain from using mobile phone for 1 week, or maybe we can, as therapists, can stop using sugar or stop taking tea, and see how difficult it is to take that decision, or how difficult it is to stop doing something that we really like. If we are able to experience that by ourselves, we will be able to empathize with the patients that comes to us, the addicted people, because it's not always easy to stop something. It's really hard. So these are few things that we can adopt in the treatment mechanism. And there are a few things that as parents or as adults, we can teach other people that we should be able to teach younger ones to say no, to connect with family and friends. And moreover, that we should be able to teach them to enjoy life without, and doing things that they like without adding any addictive substance to that. And try to talk to younger generation about the factors or the issues that is caused out of this addiction. Because the current generation, it's a generation that values fact. If you give them the fact, there are more chances for them to listen to you. If you just give them advice, they will never listen to you. Give them fact. It's a fact-based generation, so there are greater chances for them to stop. I won't say that people won't use alcohol or people will use alcohol after awareness and all, but our aim should be to at least stop them from doing all these things till the age of 20 or 25, because that's a very important phase of their life. As the later the onset is, the more good it is. If they're starting this pattern in an early age, that is very problematic. So teach them about it. Teach them to plan ahead of the trigger warning, the chances that they might situations where they will be forced to take alcohol or any other drugs, and plan ahead of that. Like if they're going for a party or going for a tour, tell them that there might be chances for people to force you to take this, but it is your decision, it is your life, you have to take the decision. Make them to plan about a future and take control of situations. And if they are in a very bad situation, motivate them to seek help. So these are the few things that we can teach our children. And we have learned about the treatment and other things. And also, it's always better to prevent rather than treating something. So when we are talking about the prevention, there are two things that we usually talk. The first one is there are certain risk factors. So we should be able to identify those risk factors and then eliminate those risk factors. And also there are various protective factors that help the person from getting addicted to something. So try to nurture these protective factors or give these protective factors to young people and try to eliminate the risk factors. So there are a lot of risk factors and protective factors in the community level. For example, if the drugs are easily available, that's a risk factor. If there is a low level of community attachment, all those things can act as risk factors. So instead of that, try to give them protective factors like exposing them to evidence-based programs, awareness, and involving them in social activities and all. And coming to family also, there can be a lot of risk factors. Genetics can be one factor. Family conflicts can be a risk factor. And family history of any personality disorder, antisocial behavior, or parents' attitude towards the children, parental influence, all these things are risk factors. So we can try to, since we know the risk factors, try to work in the opposite direction. Try to create a good attachment. Try to try to connect with them. Try to talk to them openly. So these are few things that we can take care of. There are risk factors in community level, family level, school level, individual level, and there are also protective factors that can help us to help people to stay away from them. So protective factors like teaching them social skill and emotional control, and giving them an open space, and a lot of other things can be done. So it's almost 7:30. These are the few things that we have discussed today. We talked about what addiction is and how addiction is affecting our brain, and why is it difficult for a person to get out of it. And we talked about various factors related to youth and addiction, how their brain is primed to get addicted to things, and what can be done with that. We also talked about a lot of factors that contribute to the development of addiction. And importantly, coming back is possible, and there should be an open and empathetic attitude towards addicts. It's a condition that they are going through, which is developed due to a lot of other factors. So try to be empathetic, and we discussed about the treatment and prevention. In prevention, we talked about the risk factors that needs to be identified and eliminated, and the protective factors that can save a person. Also, I would like to end the session with this simple note. Addiction is not you, it's a cage. It's to the people who are addicted to something. And recovery from addiction is an ongoing process. And it's an ongoing process for the addicted person and for their family. And there is hope, and hope is a wonderful thing. Thank you. Open to questions.
Thank you for the participants. Please do list your queries in the chat box. Ma'am, we have some questions to be answered from the YouTube live comment section. Can I?
Sure, please.
First question is, do intake of caffeine affect young minds?
Intake of caffeine. Caffeine is actually an addictive substance. It have addictive property. So excessive use of anything is not good for our body. It can create addiction.
Yes, ma'am. We have another question too. Does chocolate have same effect as drugs?
I'm sorry?
Does chocolate has same effect as drugs?
Yeah, chocolate is also something that is listed under caffeine and other things. So it also have slight effects. I wonder someone in the audience or participants who can help me with this, who have other things to contribute to this point.
Ma'am, will be added later. Is there any more questions, PT More? Can we cover it up first?
No, ma'am. It's over.
No. Okay.
Ma'am,
Yes.
ma'am, I have one question.
Ah.
Ma'am, nowadays a lot of adolescent kids are becoming a game addicts. Why is it so?
I'm sorry, nowadays?
Nowadays, a lot of adolescent kids are becoming gaming addicts. Why is it so?
Game addict. Okay, so game addiction is a condition that is listed, and there it is similar to the effect of any other kind of addiction. It's a behavioral addiction, and it may be because of the environmental factors that a lot of people are getting addicted to that. And also the young generation is exposed a lot to the screen, and they are getting a lot of the thing with screen or thing with using phone and other things is that they get a lot of stimulation. A lot of dopamine rush will be there. It's all kind of instant gratification that they are getting. And even in games, it's like you complete a level, you move to the next level. If you move to the next level, you'll get few rewards, you'll get few additional powers or other skills in a game. So it's kind of something that stimulates our brain. So there are greater chances for young people to go for that. It's also a condition, game addiction. It's a behavioral addiction.
Okay, ma'am. Thank you.
Hope I have answered the question.
Yes, ma'am. It looks like we have covered all the questions. The feedback form is given in the chat box. Please ensure you fill the feedback form clearly by stating your name, institute, and email ID. Now, I call upon Jisha James of first year psychology to propose the vote of thanks.
Good evening, everyone. Honorable resource person, Ms. Sajna Sajan, psychologist, our beloved principal, Father Joshi Chiramkuril, CMI, department head, Dr. Angel Thomas, respected teachers, and my dear friends. A very good evening to one and all. It is a great honor and pleasure to be chosen to deliver the vote of thanks on this auspicious occasion. First and foremost, I thank God Almighty for giving us the opportunity to organize a webinar series despite the unprecedented times due to COVID-19 pandemic. Next, I express my sincere gratitude to our resource person, Ms. Sajna Sajan, psychologist, for enlightening us with a really informative session. Thank you so much, ma'am. Next, I would like to express my sincere gratitude to our principal, Father Joshi Chiramkuril. Without his support and guidance, this webinar would not have been fruitful. Thank you, Father. I also thank our Vice Principal, Dr. Varghese Anthony, for his support. Thank you, sir. I express my sincere gratitude to our Head of the Department, Dr. Angel Thomas. Without her, this event would not have been such a great success. Thank you, ma'am. I take this opportunity to thank the coordinators of IQAC, Sushil sir, and Joint Coordinator, Anu ma'am, for making this event a success. Thank you, teachers. I also thank the coordinators of this webinar, Ms. Anisha Rajan and Ms. Benita Rose Benny, Assistant Professor, KCMT, and all the other teachers of Psychology Department who have worked hard to make this event a memorable one. Thank you, teachers. I finally would like to thank each and every one of you who have attended the session through YouTube and Zoom platform. And thank you so much for your valuable presence and attention throughout the webinar. Once again, thank you all and have a great day.
Thank you, Jisha. So we have come to the end of the webinar. On behalf of KCMT, I thank each and every one of you. We appreciate your presence. Have a happy and safe weekend. Thank you.
Thank you. On one question that has to be yet answered regarding the